Yet another Obamacare deadline is getting changed. America's health insurance plans. The board of the insurance industry's biggest trade group is extending the deadline to pay the first month of Obamacare plan premiums until January 10th instead of the previous New Year's Eve deadline. With more on this, Avik Roy, scholar at the Manhattan Institute. Always great to have you here, Avik. You know, it seems to me that if Obama was twisting the arm of the insurance industry any harder, it would have broken it already.
Yeah, they've been very aggressive and in a really unethical way. They're changing the rules of the insurance industry to bail themselves out politically because they're afraid of the fallout of people losing coverage because of Obamacare.
Is that the reason they agreed to this?
Well, the insurers had a different incentive, which is, first of all, they're looking out for the consumers. They're looking out for their business interests, which is to say,
yes.
if the consumers,
let's be real here.
If the consumers can't enroll in the plans, then they lose business, right? So they want to make it easy for consumers to sign up, and they want to make sure that they're compensating for all the foul-ups with the healthcare.gov and all that. But it's pretty unethical for the administration to try to force insurers to do that. Insurers to do that voluntarily, that's one thing. For the administration to say, we're going to run you out of business if you don't do what we want to protect us from the political blowback, that's wrong.
I do think that insurers are trying to look after their own interests in extending this deadline. I think that's certainly part of it. But in reality, they don't have their own private business anymore. This law, Obamacare, really fundamentally changed the nature of this business. You said it best. You said it's really just a big state-regulated utility.
Yeah, and particularly with these regulated exchanges. I mean, it doesn't have to be that way, but the administration has turned it into that way because the people in the administration who are in charge of running these exchanges are really hostile to the industry, don't understand how business works, and so they say the industry is something to be tolerated rather than something to be supported.
That's really interesting, and I think it's dead on and exactly what you see as a reporter when you start covering some of these insurance departments state by state. They don't trust the insurers. They don't want to work with them. Absolutely. Interesting stuff. Now, we're also starting to see some of these state-run health care plans are starting to say, you know, we may not go along with the president, which is ironic given that they're part of the government and these insurance companies are not. Some of these state plans are saying, we may not go along with you.
Yeah, I mean, it's going to, they're not everyone's going to do what AHIP, as you said in your opening, is suggesting, but the reason why AHIP decided to do this as a group is because they want to make as much of a standardized system so that insurers know that if they do take on these patients and lose some money taking on these patients that the government has messed up, then everyone else, most of their competitors will do the same. Some competitors will be outliers. They're not going to sign on to that because they don't want to lose the money.
Right.
But I think many will just because it's a way of saying, well, let's not screw each other over this.
Here's what I'm worried about. I think there are a lot of people trying to get through this boa constrictor. There's a big bulge, and I'm not sure everybody's going to make it. How is it possible that all these people who have tried to sign up for Obamacare are actually going to be able to close the deal by even January 10th?
Well, by January 10th, what we know for certain is that more people will have lost their coverage due to Obamacare than will have gained coverage because of the enrollment.
It's ridiculous.
Now, maybe those numbers over time even out, but certainly for the first quarter, it's going to be pretty bad in that sense.
So what's going to happen? So by law, you're sort of required to have coverage,
yep,
and you can't get it because the government website isn't working. And so then what happens? You go to the doctor, you think you have coverage, you show your card or you tell them who covers you, and there's no money?
And that's what the insurers are terrified of. They're terrified of an individual going to their doctor, having an episode, an illness, and then thinking, oh, I'm covered, here's my bill, insurance company. And the insurance company says, we don't have any record of you, we're not going to pay this. And then the insurer is worried that they're going to get blamed instead of the government. So that's one of the reasons why they took these steps, because they want to just make sure that doesn't happen, that that consumers do get the coverage when they think they have coverage.
Avik, what do you think? I mean, we don't have a lot of time left, but net, what's going to happen in this first quarter? How is this going to get resolved?
Look, it's going to be disruptive. There's going to be a lot of people who are unhappy. But, you know, the major remember, this is a small slice of the insurance market. This is only for people who shop for coverage on their own who are uninsured today. The real bomb that's going to go off is going to be the second half of next year when people on employer-sponsored plans find out that their rates are going to go up by 20, 30, 40%. That's when, and that's going to be right before the election. There's going to be a lot of stories like that coming up. So remember, this is just a small portion of the market.
So much more to come on Obamacare, and I hope you'll be with us every step of the way. Thanks for coming in, Avik. Great to see you.
Thanks a lot, Gerri.